So for those of you that do not remember me, my name is Eduardo López-Granados. I'm a clinical immunologist, and I work in the immunology department of Paz University Hospital. I'm acting within this collaborative effort as the research working group coordinator. So in some previous board meetings, there was an agreement to try to, from the research working group, to identify some areas that could be needed of increasing research efforts, and somehow to, as a network, and thanks to the capacity that we all together put together as a multidisciplinary and multi-institutional organization, to identify some areas of research and somehow to do some efforts in raising the need of increasing research efforts within the area of transplantation, to increase or to give us some more tools that could allow us to improve the outcomes of our procedures. So it's part of the requirements of the network to create or to define at the beginning of the project and to update periodically a research strategic plan. And this research strategic plan includes the need to identify some research gaps that the network could point and could help to fill by raising awareness about different research institutions and the research community, and also ideally around or among funders, public funders, and even industry, when it's possible to somehow increase the research capabilities in the area of each ERN, in the area of interest of each ERN. So to do that, just almost 3 years ago, at the beginning of our project, we circulated among the different participants, the healthcare providers, a research survey that tried to collect different types of information. First, what were the areas of active research in which each institution was developing efforts, and this included areas of the whole scope of potential areas of research within the pre-transplant, transplant, and post-transplant period for all the types of transplantation, hematopoietic stem cell transplantation and solid organ transplantation. And with that survey, we try to identify the major or the more important or the more burning areas in which research should try to be focused. In addition, in the discussions that we had within the research working group and in the boards, and also thanks to the effort of other working groups from the network, for instance, healthcare and the clinical guidelines and education working groups, we were identifying areas that could be prone to somehow reflect about the needs. For instance, in the healthcare group, there was an initiative to do some different audits, clinical audits of what were the approaches and the standards and the first that was the management and PT. Some differences in how different institutions approaching this problem, the process of decision making, and even the tools, the analytical tools, the biomarkers, and other tools that they were used in each of the centers, the cutoffs of the standards that were used to interpret these variables, these laboratory variables. So the idea of doing audits is that to detect the heterogeneity and trying to set the grounds for future harmonization of standardization of procedures whenever possible. And also there was an attempt not only to do clinical audits, but to using an established methodology to really develop clinical guidelines, or depending on the level of evidence that was available, that would be available in each area, either clinical guidelines or documents of experts, depending on the level of evidence that we could compile in each of these efforts. But the important thing is not only the survey that we did, but the conclusions of these clinical audits and the definition whenever they are finished, for instance, of the first clinical guideline that is being produced, which is the minimization of immunosuppression in the long term of the transplanted children. The idea is that detecting what was the clinical activities and how different hospitals were addressing the management of the patient could also help this heterogeneity could also help to identify some research gaps, either translational research or clinical research, that could somehow help in this effort of harmonizing the clinical approach to different areas. For instance, if there is some clinical decisions that are not based in good laboratory variables or good biomarkers, because the process of the hepatopathogenic process is not completely understood, or for instance in PTLD, the differences in interpreting, for instance, the viral activity or the viral loads, or the attempts that some groups may be doing to not only attending the viral side of the risk of PTLD, but also the status of the immunological competence of the individual and the immunosuppression level. If, for instance, the conclusion of these guidelines or these audits is that there is a significant heterogeneity in different approaches, protocols, procedures in different centers, that could indicate that we cannot have a common set of laboratory variables, for instance, that could help us to really introduce them, hopefully, in a more routine in a day-to-day basis, in a more just some variables that could be implemented on a routine basis to help this kind of decision taking and to decrease the level of heterogeneity. So we what we did is that attending to the results of the survey that we launched some years ago, the conclusions that we reached, the discussions we had along the different meetings of the research working group and the board, and also taking special attention to the conclusions of the ongoing efforts in terms of clinical guidelines and clinical audits, we identified several areas that we thought could be suitable for this attempt of somehow producing paper or hopefully a manuscript that could also identify in the literature and in the current ongoing projects what would be the gaps to fill up in the future, and that way somehow to stimulate and to promote particular future efforts trying to address those gaps with some particular projects, some particular hopefully initiative that could be also benefit by this awareness about the need of more research in the area of pediatric transplantation that could combine, some could move to the funding bodies of different levels, nationally or internationally, really to include these kind of topics in future calls, for instance. So we identify several areas. For instance, we made an analysis of the reviews that are available in the literature regarding the induction of tolerance in solid organ transplantation, using, for instance, cellular therapy. That was one of the areas that was pointed out in the survey among different centers as a hope, as a future to really give just to take another steps in terms of immunosuppression minimization. The other was to the idea of the hope of in a future to have some schemes for more personalized or tailored immunosuppression, to really scheme to it more personally or more specifically than really just following general protocols or general measures. The idea is also of including some analysis of what is the state of the art in the long-term monitoring of immunosuppression in terms of pharmacology of the immunosuppressants, in terms of pharmacodynamics of the immunosuppressants. For instance, if we could really identify what would be the status of the introduction of the omic approaches in different areas around pediatric transplantation. For instance, the early detection of graft versus receptor disease in hematopoietic stem cell transplantation and multivisceral and intestinal transplantation. The idea of using genomic approaches also to identify biomarkers of acute organ rejection or early tolerant operational tolerant detection, either in blood, in tissues, in different sources. And finally, we also identified as an interesting area to analyze the disponibility or the availability of biomarkers, of biological biomarkers, really to monitor or immunomonitor the chronic viral infections and the risk of PTLD. Why this? Because we thought that it would be a nice follow-up effort after the effort that is being done and hopefully will be finished soon by the clinical guidelines the healthcare working group of doing a survey and a clinical audit, as I said before, in the detection of the different approaches that each center has to minimize this risk. So what we did is just to make a strategy of literature research, thanks to our experts in the coordinated center in terms of bibliography and the use of databases and PubMed, Carlos and Laura, and we made a preliminary search of what would be the number of reviews specifically in each of these areas. And as you can see here, there are some areas that are very rich in terms of reviews in the literature that somehow will include this content. For instance, when we mention the reviews that could be focused on the use of personalized approaches in terms of immunosuppression, there are almost 2,000 reviews in the literature. But in order to start with something that could be like a pilot study that could help us to establish a methodology and really to see if this will be a doable effort and an affordable effort in terms of time and the number of people that could participate in these efforts, in order somehow to, let's say, using our network as a think tank for the area of pediatric transplantation and really to produce periodically or with time some papers that could really reflect on all these topics. We decided to make a first pilot study that we are gonna accomplish in the coordinating center and that we would like to explain you briefly today. So we decided to start with this area of biomarkers for monitoring or immune monitoring latent or chronic viral infections and the risk of PTLD. So what we decided is just to follow a methodology that could convince any future peer reviewer that the analysis that we were doing of the literature was really methodologically correct, and that we were not just reading a number of reviews in the literature and deciding a small group of people what would be the conclusions of the analysis of all these reviews. So we tried to look for a methodology, and in that Carlos Martinez Saborido, which you know is one of our experts in clinical guidelines and the methodology for the establishments and of clinical guidelines, and more recently Laura Pruneda, who is also helping us in this effort as a member of the coordinating team. We thought that there is an option, which is to follow up the methodology that is established by the Cochrane effort to define what is an overview of reviews. So the overview of reviews is a methodology that could focus on studies or clinical guidelines produced by the Cochrane or already analyzed by the Cochrane, but it could also be applied to other types of reviews that are not particularly clinical reviews or clinical audits or studies analyzed by the Cochrane. So the idea is to use the same methodology in order to define a way to work in which we could be systematic in the analysis of the literature, the selection by at least 2 people of the relevant reviews according to some terms and some standards for each of the areas that we would like to review, and to really establish a way to extract data from these reviews, not necessarily going to the original papers that were used to produce this review, but also to really, at least by one person, and then with the confirmation of a second person, really to be sure that we analyze the available reviews in a way in which we could produce some conclusions. So the idea is that we will try to do in the next couple of months a pilot effort, to identify attending to what is available in the literature and what are the areas that are named by different reviews as potential research areas for future improvement of the clinical management of these, as you know, relevant complication that we all see, likely not very frequently, but still see in our patients that are transplanted and under immunosuppression. And the idea will be to identify the reviews that are available in addressing this point, the availability of markers or biological variables, really to help in the analysis of the activity or the status of activity or reactivation of chronic viral infections, mostly herpes virus infections, and also the early detection or the early management of the risk of PTLD and the types of PTLD that are still arising in these children. And as a second stage, after our clinical audit has already been produced and has been published and has been somehow finished. So we thought this could be an interesting second chapter of this effort, not only identifying what is the current practice, but how that current practice could be improved and could be harmonized by the generation of more analytical tools that could be provided by research effort. So the idea is that we reduce the number of reviews to analyze to a little bit more of 70. And the idea is that we are going to do an effort to analyze those reviews to produce these conclusions that we will obviously share with all of you. This is just an attempt to see if with this number of reviews is more approachable than maybe in a larger area. But the idea will be to prove that this is a good approach, that it could be well received by the scientific and medical community if we make an effort, and that hopefully this effort could be used to expand it to different areas in the future And obviously, this will be just a preliminary effort that we will complete with all of you that are interested. So we are just setting the grounds and just proposing this approach that was already agreed by the research working group a couple of years ago in one of the board meetings of the network. So hopefully, if the conclusions are robust and the methodology proves to be correct and robust, we will try to publish these results. And as I said before, we will try to expand it to other areas in any of you will be interested in participating, and those areas will be discussed in future research working group meetings. And with this, I just want to thank all of you that connect to this webinar or had an opportunity to review this webinar, and I hope to see you again in future opportunities. Thank you very much.